Hi everyone, my name is Gregory. Today I would like to share with you some clinical tips what I've been presenting in this case. This patient came to my office with a chief complaint that she has multiple cavities, she doesn't like your bite, she doesn't like your appearance of your front teeth, and her front tooth start chipping. So from a dental history, we find out that the patient doesn't have a stable bite. So for us to achieve the stable bite and nice result, and so the patient will not crack your front teeth on your permanent crowns, we have three reference points from the occlusal course. It's a P1, P2, and P3, where the P1 is a reference point from the joint, what we call CR. Second is P2, it's a MIP, maximum intercuspal position, and P3, it's anterior guidance. So we know that she doesn't have a P2 and a P3, so the only reference point we have is P1. But the patient complains that she has to find her bite. It means the bite is not stable. And all this, when she bites, she has tendency to move her lower jaw towards the front. Besides her other oral habits, I want to make sure that when I deliver my restorative crowns, she will not repeat the same problem with the permanent restorations. So what I've been doing in this case is we took some pictures and x-rays, collected data, and we see some secondary cavities all around the crowns and some virgin teeth which is never been restored. And we remove the crowns, we remove secondary decay, and also for my technician, I took a stump shade of the patient's preparation, so my technician knows how to cover those restoration and establish nice aesthetic result. So I create my temporary crowns. I didn't have a wax up, so it was all the freehanding. But my point is, so how can I probably transfer the reference point for my technician so he can probably create the crowns in the proper position? So I've been doing the next is on the crowns on 89, I try to put a composite, small composite, cured, and ask the patient to close her mouth up and down and make sure so I will establish the nice small contact between upper and lower jaw. The rest of the teeth is going to be separated, it's only the front teeth is going to be in contact. So I've been using the blue paper, and we notice the blue paper is 200 microns. Then I use the red paper, which is 20 microns from Parkel, and I want to make sure that the blue spot and the red spot are coincide with each other. Why it's so important? It's important for me to deprogram the patient to make sure that I'll find the reference point or the original position of the lower jaw of the patient. I'll ask the patient to open and close her mouth for the next 15 to 20 minutes. And when I come back, I want to see that this spot are repeatable. If this spot in 15 to 20 minutes are repeatable, it means the patient deprogrammed. So when I establish that the patient is deprogrammed, I'll go for the next step. So I'll put another composite material. While it's soft, I'll ask the patient to bite down. And the patient bite down, and keep the mouth closed, I will cure this composite and make sure that I will lock the jaw in that position. So every time I'm going to take the impression of bite registration material, I know I will establish repeatable bite. So the next step, I'll remove the rest of the crowns, the temporary crowns, and I'm going to leave only 89. So the first we'll take the final impressions. This is for a repeatable, so we can have cross arch articulation. So I'm going to leave the crowns, the temporary crowns, 89 with this bite. Okay, for the bite registration material on the missing teeth, I let the patient bite. So I want to make sure the patient bites and bites in the same position. So that's bite registration material is going to be transferred to the technician. Then I'll take another final impression, keeping this 89 tempered crowns with the same deprogrammer, and I'll take another impression from the prep teeth. This way, my technician can cross-arch in mounting the models and can create the final restorative crowns at the position when I want it. So when I send the patient back, home, the patient came back to me. We received crowns from my technician, and also I can establish nice bite, nice aesthetics. I check the bite in the patient's mouth, cement the crowns, and make sure we establish a nice bite. So the patient at that moment says we established the bite. She Joe does a move. She finds the bite right away. And also when I cement my crowns, I'll start from my front teeth. I want to start doing like a facial generated treatment plan, so make sure my front is in the right position. So in order to avoid the problems again in the future, when a patient in supine position, I put my forefinger horizontally on the front teeth and ask the patient to bite down. If I don't feel any fremitus on my front teeth, I mean it's alright. But I'm gonna check with the blue paper. If I see any streaks left in the front teeth, especially the teeth from 7 to 10, okay, I will eliminate those blue streaks. I mean the sliding position. I'm gonna leave only on the teeth on 6 and 11 to give the patient canine guidance. So on the supine positions, and I establish there is no fremitus, I put the patient in up front position and ask the patient again to close the mouth up and down and make sure there's no fremitus on that. So my point is, when I establish the front guidance, I want to make sure that I have only the blue marks. There is no red marks on the front teeth from 7 to 10. So the canines from 6 and 11, I want to make sure I have a blue streaks and I have red dots. Thank you.